So thanks for the opportunity to introduce Nellie to you. I was really hoping that I'd have more information, more case information to tell you about how I've been using her in our practice, but there's been a few problems along the way. So as Mary said, I work in inner city practice, and we have 10 doctors, and I work with my colleague Denise with job share, so we work 3 days a week each. In preparation for healthcare homes, and thank goodness we didn't get the healthcare homes grant, but we were successful in getting a grant called Capacity Building for General Practice through our primary healthcare network, and that led to me searching for new and innovative ways of engaging with our chronic disease population, and hence led me to Nellie. So I'm just briefly going to tell you who she is, where she comes from, her aims, how she works. If we've got time, I'll go through my case study, next steps and contacts. So who is Nellie? Where does she come from? Well, Nell is a simple interactive telehealth service. She uses mobile phone text messages to monitor symptoms and provide support, advice and reminders. Nellie was developed in the UK, where she was called Florence or Flo. She's been rolled out across the UK and has been used with over 70,000 patients, and that link will take you to many, many stories of how she's been used there. So she's called Florence in the UK, she's called Annie and Clara in the USA, and in Australia, Nellie. So there's a slight gender bias going on there. I wonder if we called it Bruce, whether that might have made a difference. In essence, Nellie is a persona that patients interact with via simple SMS mobile text messages, just like they would do every day with their family or friends. She feels friendly and familiar to the patient. She motivates sustainable behaviour changes through engagement and education around their condition. There's no app that needs installing, and her messages are supportive and easy to understand. Contrary to what you might think, older people have adopted mobile phone use and are quite competent at sending and receiving text messages. Unlike hot docs, those of you that use hot docs, there isn't a link for validation. They don't have to go to any other screen. It just comes up as a text message. What are Nellie's aims? In essence, your best practice healthcare advice and patient education, plus improved engagement and adherence, will equal better and faster clinical outcomes. Nellie is protocol driven. So the protocols have been developed in conjunction with clinicians and incorporate evidence-based guidelines such as Heart Foundation. The messages from Nellie are designed to reinforce what the patients will have discussed with their clinician, most of which they'll forget when they leave the consult. Linked to the protocols are care plans, which are flexible and can be individually tailored to the patient's needs. Messages from Nellie can prompt the patient to send in a result such as blood pressure reading, blood glucose, mood score, weight, number of cigarettes smoked. She can be a reminder, for instance, to take your medication. Nellie can provide educational messages or motivational messages. So patients learn more about their health issue and start to understand the ways in which lifestyle and medication manage their condition. Patients take on a more prominent role in self-management, and Nellie promotes increased patient activation through their ongoing monitoring and contact. So a good way to think of Nellie is someone holding the patient's hand, gently guiding them and encouraging them to follow their action plan once they have left the consulting room and returned to their everyday life. So Nellie hits Australia. Nellie was introduced to Australia by South East Melbourne Primary Healthcare Network at the end of 2017 and has been rolled out during some practices in the catchment. In the early stages, so because of our work on the capacity building project, I went along to the first presentation about it, and I thought that Nellie had some really great features, so I put up my hand to take on being an early adopter of Nellie in our work. However, within my own practice, and the way I thought I would start using it was through the healthcare grants, where we have enrolled 30 people on the coordinated care kind of pathway. When I first brought her into the practice, there was some lack of consensus amongst the GPs and agreement about some of the more clinical protocols. So instead of getting bogged down in that, because it was time limited, we decided just to continue on with the lifestyle protocols, which they were not controversial. So at the moment, we're just using the medications and the walking, and have introduced one called Sweet Treats. So this is what it looks like. So these are the protocols. So as I was saying, it's protocol driven. So at the moment, there's a few more coming along, but these are the ones I did a screenshot of just recently. So there's a closed loop interaction between Nellie and the patient, and I can choose from those protocols which protocol will fit the clinical scenario of the patient that I'm managing. And then I can personalise that. So there's another one that's being developed at the moment, which I think will be really great. That's the 3-day structured glucose monitoring. So behind that, for instance, here's an example of the hypertension, so the uncontrolled blood pressure monitoring. This protocol is designed for daily monitoring of blood pressure for patients with uncontrolled BP. The patient will take a daily recording and send in the reading. Nellie records readings or symptoms and displays them in a clear graph or a colour-coded table format, making it easy to do a clinical review. This is the heart failure one. This is fairly new. So this is looking at tracking and recording of weight gain. So I know they're pretty busy slides. I just want to show you the protocols that are behind the actual messages that go out. So in this one, not only will Nellie acknowledge the daily weight measurement, but an alert will also be triggered to the patient and the practice team if the patient has gained more than 2 kilograms in 2 days. And attached to that then is the action plan. So you would go through the action plan with the patient so they know exactly what action to take and when. And this would be familiar to you. So it's all using clinically currently available guidelines and best practice methodologies. So how does Nellie work? Well, this is what the home screen looks like on my computer. So in the squares are the names of the patients. The patient comes in and has to consent to using Nellie, and also to understand that they have an agreed responsibility to follow the actions that Nellie is requiring and to respond back to Nellie. Nellie will interact with the patient according to the protocol until their next appointment, or she will tell them to book an appointment sooner if the parameters exceed predefined levels, such as in the previous example, if someone gains over 2 kilos weight in the heart failure protocol. So we started using Nellie with 4 staff members, 3 of whom continue to still use it for her own lifestyle reminders. And this was really important. I think I jumped in a little bit too quickly with too much enthusiasm, but I've learned that Nellie is not for everybody. Having my colleagues use it for a few weeks before enrolling patients gave me very good, direct, unfiltered feedback, including turn her off. So the protocols that I have used with some success have been the step counting protocol to help embed behaviour change, and the medication protocol. And I'm really hoping that I have some time to start using Nellie in wider protocols. So this is what it looks like, the example of the counting steps. So Nellie will send a message saying, day 1, hi, it's Nell. I'll be with you during your journey to record your steps and progress and keep you on track to hit your goals. Let's get walking. So there'll be a check-in every day, and it's, hi, it's Nell here. Please send me your step count for the day. Reply steps, blah, 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 take care. If there's no reply, Nell will send another follow-up message saying, hi again, haven't received your step count. Please reply. And then Nell will go into the logarithms of depending what steps people have used. And we've come up with 2 walking step counts because there's one group of patients that even doing 100 steps is great. And another group of patients you might want to be encouraging them to do the 10,000 steps. So the beauty about the protocols is that it really can relate to the different patient groups. So I don't want to read the whole case study, it's on the poster, but in essence, the medication protocol I use with great success with Deb. Deb's a 64-year-old woman. She's got an acquired brain injury. She was new to the clinic. So this for me was the crux of, this is how I think it actually worked well for me. When I've been talking to now with my patients, my chronic disease patients that I've known really well, they think it's a really interesting idea, but haven't really wanted to start using it because they think that everything that they're doing is quite fine. But Deb was new to our clinic and had all these clinical issues, so I was able to say, right, and one of the ways that we manage things in this practice is we enrol people in NEL. She was really happy to give it a go, and so she signed up and NEL started messaging her every day. That has really helped her with her medication, with her blood pressure medication. It hasn't helped with her insulin, so her reduction in her HbA1cs is because she's changing insulin, but it has helped her in remembering because NEL messages her at 8 o'clock in the morning and she directly goes and takes her medication. Her insulin she does at all sorts of interesting times, but we've been able to get something with that. The walking protocol was an easy one, so Mr. Chris was doing quite well. He's had his CVA, he went through rehab, kept himself active, but then his weight started to creep up. He found it difficult to be motivated with his walking, so putting him on the walking protocol was really great. He did it for a couple of months and then he said, I'm fine now, I'm doing it every day, it's part of my behaviour, so I've discharged him from that protocol. So, just finishing off, the key steps for me is patient selection. Most useful when commencing behaviour change with patients, so people have to be in the stages of change ready to take action. Otherwise they just get annoyed with this message that's just popping up and they're not really ready to do the work. So making sure that you've actually gone through with people and they're at the stage of taking action. Getting your GPs on side. So I haven't had the time to actually try to change that process of getting our clinicians more on board with the clinical protocols, but I can see how valuable they can be. That's my next task. Also, don't set up expectations that you can't fulfill. So if I'm going to be saying to people, send in your blood pressure results every day, if I'm not monitoring that to see what's coming in, then that's just false advertising. So making sure that what you set up, you're actually going to be able to do and monitor. NEL is an easy system once you know how to use her, but she's a bit time consuming to get onto the screen, and if you haven't used her for a little while, it does take a bit longer. And if you've got a busy day and you haven't set time aside for it, you're getting on with your day, you flew clinics, and you forget you've asked Deb to report in her blood glucose levels twice a day, and they're too high, and you haven't checked that, then that just is a recipe for disaster. I also think, and this is following on from Robbie's talk this morning, is that I am not a great social media user, and I think that if I was much more, not that I'm not familiar, I just don't use it, but I think I need to have on my phone Nellie set up to be shooting messages at me, and I need to be checking a lot more. So I think with younger nurses or more socially media savvy nurses, Nellie's got a great future, and I think I need to change my behaviour to be much more up with that. Questions? Not it. It's completely standalone. Yeah, it's completely standalone. It's web-based. Yeah, none of that yet. So, well, but Stanford and God love them. Have given it. My primary healthcare network have given it to us to use. So this is part of what Stanford is doing, and that's why I want you to know about it, because it might be really useful for some of you, and Stanford needs to know so they can keep funding it.
Sorry, I've got some cards on the facilitator. I'm more than happy to share my contact details if you want to contact them. I can pass it on to them.
And there's some cards on the table. If you were going to be setting up a blood pressure monitoring one, you would have very clear guidelines with that patient, and you would be checking, you'd making sure. So you'd be working with your clinicians, and you'd be teaching your patients about what they need to do and what the parameters are. So it would be very clear, and when there's a reading that comes in that's out of the ordinary, it comes up in red. So So what I'm saying that we need to, so for me it's a learning about needing to keep looking at it to make sure that I'm aware, and being aware that if I was asking people to do that, that I actually check. But there's a consent that people consent to as well.
Yeah. On top of that, there's a consent that very explicitly explains that this is self-management and the onus is on the patient. If they have an advice from Nellie that they need to seek medical advice, then that's what they are agreeing to do. And Nellie will send you out. I was on the blood pressure protocol as a guinea pig, and I was putting in random results, not checking my blood pressure, just putting whatever numbers popped into my brain. And if I put in a high reading, it would tell me take your blood pressure in an hour. If it was a medium range, if it was a very high range, it would tell me to go back and go seek medical attention. I was mucking with it. Anyway, thank you very much, Sharon.